Hello, my name is Caitlin, and I'm a pediatric pharmacist here at Orlando Health Arnold Palmer Hospital for Children. I'm going to talk to you today about an oral medication called Cholecalciferol, or vitamin D. This can be purchased over the counter, or it may be filled as a prescription from your child's pediatrician. This medication may be used to treat or prevent low vitamin D levels in the body. Vitamin D helps your child to build strong bones by increasing the amount of calcium and phosphorus absorbed in the body. Enough vitamin D in the body also prevents rickets, which is a condition of softening of the bones caused by low vitamin D levels that can happen in growing children. For babies who are fed only breast milk, this does not provide all the vitamin D that a baby needs. Breastfed babies will need a supplement of 400 units of vitamin D per day, beginning shortly after birth. Babies receiving less than 32 ounces of infant formula per day will also need a supplement of 400 units of vitamin D per day. For children who have started eating solid foods, the medical team will prescribe the appropriate dose of vitamin D. When your child takes vitamin D at home, you should give them the medication exactly as prescribed by your doctor as directed on your discharge instructions. If your child misses a dose, give it as soon as you remember. If it's almost time for the child's next dose, give only that dose. Do not give double or extra doses. If your child is taking the vitamin D tablet, they should swallow the tablet whole with a full glass of water with or without food. If your child is taking the vitamin D wafer, they should chew or crush well prior to swallowing with the largest meal of the day. If your child is taking the vitamin D liquid, make sure to shake well before use and pull up the prescribed dose of the medication using an oral syringe. The liquid medication can be placed right in your child's mouth. It can also be placed in your child's feeding. To do this, you can place the entire dose into the small amount of feeding and give to your child so that they receive the entire dose. Remember to measure the dose by lining up the top of the outer black line of the plunger with the desired dose or the number on the syringe. The straight edge of the plunger is used to measure the medicine. Do not measure at the dome. Also, do not use a household teaspoon or tablespoon, as these are not accurate measuring devices for medication administration. It's important to note that the liquid formulation of vitamin D is available in different concentrations, so pay close attention to the concentration and make sure to talk to your nurse, doctor, or pharmacist if you have any questions about the appropriate volume to give your child. It is very rare for vitamin D to cause side effects for your child, but in rare occasions, patients can develop an allergic reaction. If you think your child is experiencing a severe allergic reaction or anaphylaxis presenting as hives, swelling of the mouth, face, lips, tongue, or throat, or trouble breathing, it's important to seek medical attention right away. It's also important to seek medical attention right away if your child is showing signs of high calcium levels like weakness, confusion, feeling tired, headache, upset stomach and throwing up, severe constipation, or bone pain. If your child spits up the dose or does not like the flavor, you can try to mix the medication in a small amount of the child's feeding, as previously mentioned, to ensure that they receive the entire dose. When you get home, keep the medication in a cool, dry place at room temperature, away from heat or moisture, and away from small children. Make sure to listen closely to instructions described by your doctor, and please let your nurse, doctor, or local pharmacist know if you have any questions about this medication. Thank you for watching, and goodbye.